Hello, I am Carol Barnhart, and welcome to this edition of To Your Health. Today I will discuss women's heart health with cardiologist Dr. Scott Eisenberg of Jersey Shore University Medical Center. Thank you for joining me today, Dr. Eisenberg.
Thank you for having me.
Could you give us a little bit of information on your professional background?
Certainly. I've been practicing in Monmouth and Ocean County for the past 11 years. I'm a board-certified cardiologist practicing both non-invasive and interventional cardiology. And I took a little bit of a turn in terms of my progression about 8 years ago, where I invested a lot of time and effort into the field of lipidology, which is the study of your cholesterol and how we manipulate it to prevent heart attacks and strokes. And over the past several years, we've also now progressed into the anti-aging field, specifically with what I refer to as vascular anti-aging, also from a preventative standpoint as well.
All right, February is Heart Month. Let's begin by asking, what are my risk factors for heart disease? Well,
we certainly have to look at the basics. Everyone has to understand that we are who we're born to. So that genetics often plays a major factor into how fast we're going to develop significant plaque in our arteries and how that's going to manifest. And then, of course, everything is what you do to yourself from that standpoint. If you don't exercise, if you gain weight, if you develop diabetes and don't treat it perfectly, if you develop high blood pressure and that's not adequately treated, if your cholesterol is not treated, so that sometimes you are what you eat, sometimes you are who you're born to, sometimes it actually is both. And if we add all those factors in, the more factors you have, the more aggressive the nature of the disease will be.
Are there different risk factors for women?
Not necessarily that there's different risk factors, but there's different presentations. Certainly with women, somewhere in the 40s, when the hormone levels begin to wax and wane, most people think it's at 50, but it really isn't. So once the levels of the hormones estrogen and progesterone start decreasing, women tend to lose that protection that they would have against the ravages of cholesterol and diabetes much more significantly. So that the one risk factor of being female is unfortunately having a waning hormone physiology, if you will. Other than that, when we look at the other risk factors such as smoking and high blood pressure and all of those things, women can accelerate how much disease they have by not taking care of themselves in those decades, in 40s, 50s, and 60s, which is why the average female at the age of 60 is going to have more heart disease and die from heart disease more than breast cancer, and actually will overtake men at the same age.
What are the warning signs of heart disease or heart attack?
Well, they're going to be different for men and women, and they're going to be different at all ages. I tell most patients, if you're waiting for the typical elephant to sit on your chest, you have to keep on waiting. So that we often say that if we think we've seen every symptom of somebody coming in with a heart attack, we're sadly mistaken. So that any change, any new symptom that you haven't had before, suddenly you're sleeping all day. Suddenly you have indigestion that's out of the ordinary of just eating something spicy. Suddenly you're short of breath. Suddenly you feel like you've overcome with the flu. Suddenly you have back pain, neck pain, jaw pain. Any sudden development of progressive symptoms, and we're not talking just little twinges, but any sudden development needs to automatically be looked at from the standpoint of the heart, because that's the worst thing.
Okay, I know there's a difference in men and women's symptoms. Could you just tell us a few symptoms that men might have that women wouldn't?
Well, men tend to have more of the typical, as I said, crushing type of elephant sitting on the chest, usually when they're doing some type of activity. Women tend to have much less symptoms typical. Many studies have been done that look at the typical is about 25% of women, whereas men 50 or 75% of the time would have those symptoms. Women tend to have more nausea, more dizziness, more tiredness, and more fatigue than men would have at the same time. So that the typical, all of a sudden burping and belching and having indigestion in a female needs to be looked at much more closely in terms of developing heart disease or as a presenting sign of heart disease than it would be in men.
What should I do if I think I'm having a heart attack?
Well, obviously, if you really are seriously thinking you're having a heart attack, we need to enact emergency services. We need to get help, 911, and call the emergency medical team. The reason for this is that the earlier that you present to the emergency room, the quicker that we can enact the medical therapy and or invasive therapy to possibly save your life. Multiple studies have shown that the earlier the presentation, the more improvement in our mortality and our morbidity. We're going to live longer, we're going to reduce that heart attack, and an invasive strategy, for the most part, has always been the best course of action. It all depends on each patient, and we have to make that analysis the minute someone gets to the emergency room. So therefore, the earlier you get there, the better that we're going to make the appropriate diagnosis and recommend the appropriate therapy.
Okay, here at Seabrook, we have an emergency system of our own. We have emergency alarms throughout the apartment, and if you have a necklace that you can push, that would be the thing to do.
Absolutely.
And then our emergency crew will take care of you.
That's very good.
Are my risk factors for heart disease the same or different from those for stroke?
For the most part, they're the same. Anything that can build up plaque is going to cause that area to have a rupture of that plaque, so that if it's in the neck, in the carotid artery, or in the brain, we can have a stroke, and if it's in the heart, we can have a heart attack. We also have the plaque that can build up in the legs as well. So anything that, such as diabetes or smoking or high blood pressure or cholesterol and inactivity, all of those risk factors that we talked about in terms of developing heart disease can also develop cerebrovascular disease, such as stroke.
Are there new techniques to treat heart disease?
Well, we certainly in the invasive field have advanced to the best of our ability. As I said, we now can get our patient in at so much of a quicker rate in the emergency room at Jersey Shore University Medical Center. That's one of the major issues that has been across the country, is the timing to evaluating a myocardial infarction, otherwise known as a heart attack, and getting that person the appropriate care. So because the system has improved to this point, our patients are doing better. We're seeing less heart attacks. We're seeing much more improvement and recovery from those heart attacks. The medications, for the most part, have stayed the same, but we've been applying them earlier and more effectively and more aggressively. And as I said, there's a large growing field of something we call lipidology, which allows us to kind of use expanded analysis with blood tests to kind of pinpoint each person's individual characteristics in their blood of their cholesterol and treat each person effectively. We can give everybody the same pill, but it's not going to necessarily affect everyone the same way. So every person's a snowflake, no one's alike, and so therefore we now have so much more of a targeted, individualized therapy for every single patient.
All right, I think you've answered my next question. Jersey Shore does have a comprehensive program for heart disease. What if surgery is needed?
Well, certainly, they also have a comprehensive cardiothoracic surgical program, one of which I've been part of for many, many years. We support that. Certainly, the surgery can be done locally. There's no need to go elsewhere, and all of the board-certified surgeons are excellent in their field, so that if you're in need of a valve replacement or repair and in need of a bypass, it has been done and continues to be done at Jersey Shore Medical Center very significantly at a growing rate. In terms of their professionalism, how they handle things, they run a very, very nice operation.
All right, I think you've answered most of the questions that I haven't asked. Is there anything else you'd like to add before we conclude?
Well, I think that where we are right now is still, there's so many unanswered questions. We want to be able to get the word out we in the cardiology field, and as well as the primary medical doctors, that we can do more to prevent heart attacks and strokes. We can do more to reduce their occurrence. We can do more to reduce the second time that someone ends up having say a mini stroke, and we want to prevent a further one. We can do so much more. It's really up to the individual to stay on top of being educated and listening to what's available out there. And it's also recommended that the practitioner themselves keep abreast of everything that's going on. It's an ever-changing field. Surgeries are getting better and less invasive. Medications are becoming more safe in a way that we're using them, and in combinations to be able to affect more safety because there's such concerns. We're trying the best we can to reduce costs so that in all of our aspects, preventative medicine is still a challenging and growing field.
Okay, I think you'll find that our doctors here at Seabrook are very aware of all these things, and they send people over to Jersey Shore for reevaluation, including myself. Didn't turn out to be a heart problem, but I had another problem. So all of our doctors here are very well educated. Thank you for joining me today, Dr. Eisenberg. And be sure and tune in for our next edition of To Your Health. On behalf of the crew of Seabrook Community Television, I am Carol Barnhart. Goodbye.